محاضرتنا لهذا اليوم عن الانتيميكروبيال كيموثيرابي. Chemotherapy as a science began the first decade of 20th century with the understanding of the principles of four important categories. The first is principles of selective toxicity. Selective toxicity means the antibiotics should be kill microbe without undesirable effect on host cells. The second is the specific chemical relationship between microbial pathogen and drugs. This means detect the site that the antibiotic is work on it, such as some antibiotic act on cell wall or ribosome or cell membrane. The third is the development of drug resistant. This is a worldwide problem in the management of infectious disease because of bacteria able to develop resistant to wide spectrum of antibiotic and the appearance of multi-drug resistant strain. The fourth and important category is a role of a combined therapy. This means used more than one antibiotic in the treatment of infectious disease. Some antibiotic when combined with together may lead to antagonism. This means two antibiotic is not effect on microorganism, but some antibiotic give a synergistic effect against microbe. This means increased activity of antibiotic against bacteria. There are some terms important to knowledge about the antimicrobials. The first is bactericidal and bacteriostatic. Bactericidal drugs have a rapid lethal action against bacteria. This means is kill bacteria, such as penicillin, cephalosporins, and aminoglycoside. While bacteriostatic drugs inhibit the division of bacteria, inhibit the growth of bacteria, such as erythromycin, tetracyclines, sulfonamide, chloramphenicol. Now, the range of action of antibiotic is different, can be classified into three main categories. The first, action mainly against the gram-positive organism, like penicillin, erythromycin, and lincomycin. يعني مثل هذا النوع من الانتيبيوتيك فعال فقط تجاه الجرام-positive bacteria. The second is the antibiotic that's active against the gram-negative organism, including polymyxin and nalidixic acid. And most important group is the third group, this action against both the gram-positive and the gram-negative organism, so-called broad-spectrum antibiotic that have broad-spectrum activity, like ampicillin and ciprofloxacin. Now, we study the mechanism of action of antibiotic. An ideal antimicrobial agent should have selective toxicity. It can kill or inhibit the growth of microorganisms in concentration that are not harmful or affect on the cells of the host. So, disinfectants such as phenol and antiseptic like alcohol, iodine, destroy bacteria, but they are highly toxic to tissue cells. and are unsuitable for use as a chemotherapeutic agent, so cannot be used as antibiotic. Thus, mechanism of action of chemotherapeutic agent must depend on the inhibition of a metabolic channel or destroy structure present in the microbe but not affect the host cell. Now there are several mechanisms that affect the microbe. The first is the inhibition of cell wall synthesis. Due to the unique structure of bacterial cell wall, because this is present in the bacteria only but not in the eukaryotic cells, this consider a good target for antibiotic. Such as beta-lactam drugs, including penicillins, cephalosporins, monobactam, carbapenems. This interfere with the cell wall synthesis and causes bacteriolysis by prevent transglycosylation and translipidation of the peptidoglycan in the cell wall. The second action is the inhibition of cytoplasmic membrane function. Some antibiotic causes disruption of cytoplasmic membrane and leakage of cellular protein and nucleotides and leading to cell death. For example, polymyxin, or inhibit the protein synthesis of bacteria by block protein synthesis and acting on 30S or 50S subunit of bacterial ribosomes such as tetracycline, erythromycin, and macrolides. Macrolides including aminoglycoside, including tobramycin, gentamicin, and amikacin. This occurs due to the differences between the prokaryotic ribosome has a covalent factor 70S, while the mammalian cells have 80S. Also, inhibition of nucleic acid synthesis, such as quinolone, rifampicin, novobiocin, and sulfonamide. These can be act on any step of DNA replication or RNA synthesis and lead to inhibition of bacterial growth by binding to DNA-dependent RNA polymerase of bacteria. Thus, it inhibits the RNA synthesis, while quinolone inhibits the DNA synthesis by blocking of DNA gyrase. هذا الانزيم اللي هو DNA gyrase الموجود بالبكتيريا يساعد على عدم التفاف DNA. يعني prevent supercoiling of DNA during DNA replication. So that is the site of action of quinolone. Other is a competitive inhibition in which the drug competes with essential metabolite for same enzyme, such as sulfonamide, resemble to para-aminobenzoic acid, which is considered as an essential metabolite for DNA synthesis. And the sulfonamide enter in the reaction instead of para-aminobenzoic acid and lead to stop of folic acid synthesis, which is important in DNA replication. Now, mechanism of resistance to antimicrobial agent. In the treatment of infectious disease, one of the serious problems is the development of bacterial resistance to the antibiotics. This mechanism by which develop resistance may be one of the following. Some types of bacteria produce enzymes which destroy the drugs, such as the production of beta-lactamase, is a group of enzymes that destroyed beta-lactam ring, which is present in the penicillin. For example, penicillin-resistant staphylococci and acetyltransferase enzyme which are produced by gram-negative bacteria, which lead to destroy chloramphenicol. The second mechanism, including ability of organism to change its permeability to the drugs by modification of a protein in the outer cell membrane, thus impairing its active transport into the cell, such as resistant to polymyxin. The third is the organism develop an altered receptor site for the drug, resistant, such as resistant to aminoglycoside, which is associated in the alteration in specific protein in the 30S subunit of bacterial ribosome that serve as a binding site in susceptible organism. This action presents in several types of bacteria. Change in the receptor. This means change in the genetic of bacteria or in the gene, which lead to produce new protein in the surface of bacteria and prevent the action of aminoglycoside. Fourth organism is the organism developed an altered metabolic pathway that bypass the reaction inhibited by the drugs, such as sulfonamide-resistant bacteria, as mentioned above, acquire the ability to use performed folic acid with no need for the extracellular para-amino benzoic acid. This figure illustrates the site of action of widely used antibiotic. I've seen some antibiotic effect on cell wall synthesis, such as cycloserine, vancomycin, bacitracin. Bacitracin not used for treatment of infectious disease or clinical cases, but used in classification and determination of some type of bacteria. This bacteria is Streptococcus pyogenes. Streptococcus pyogenes can be differentiated from other species of Streptococcus by its susceptibility to bacitracin. Streptococcus pyogenes is the only species that's susceptible to bacitracin, while other species of Streptococcus are resistant to bacitracin. Also penicillins, including ampicillin, amoxicillin, oxacillin, methicillin, and other cephalosporins such as cephalexin, cephalothene, cefotaxime, cevitriaxone, monobactam, carbamazepines such as imipinin, and others. Also, bacteria act on folic acid metabolism, such as an antibiotic, مثلا trimethoprim, sulfonamide. This prevent folic acid metabolism. The antibiotic act on cell membrane, including polymyxin, while that the antibiotic that affect on protein synthesis, some inhibit the 50S inhibitors, اللي هي erythromycin, macrolides, azithromycin, and the clarithromycin, chloramphenicol, clindamycin, or effect on 30S in subunit of ribosome, such as tetracycline, spectinomycin, streptomycin, gentamicin, amikacin, and others. And presence of antibiotic that affect on DNA synthesis, such as the quinolone, which affect on DNA guidance. Now, we study the origin of resistance to antibiotic. This origin or mechanisms may be non-genetic or genetic drug resistant. Non-genetic drug resistance include metabolic inactivity. Most antimicrobial agents act effectively only on replicating cells. When the bacteria growth, is occur, this antibiotic can act on this bacteria and kill or inhibit its growth. But non-multiplying organisms are phenotypically resistant to drugs, such as Mycobacterium tuberculosis, which survive for years in the tissue and the granulome, and their resistance is due to metabolic inactivity. This bacteria remain dormant or latent inside the granuloma, and when the patient immune response, especially cell-mediated immune response, is down-regulated, the granuloma is open and form coagulation, and the Mycobacterium tuberculosis begin to grow, then become susceptible to the drugs. But when the presence in the granuloma and when the patient's immune response is strong, especially cellular immune response, the drugs is not affected on Mycobacterium tuberculosis because of this bacteria is inactive or non-multiplying. The other is loss of target structure. Loss of target structure, protoblast or alpha of bacteria, which loss of its cell wall are resistant to penicillin because they lost their cell wall, lead to absence of structural target site of this drug. Now, as seen or as talk about this subject in the first lecture, mycoplasma is phenotypically resistant to the all beta-lactam drugs because of this bacteria is lack cell wall. شباب احنا حكينا بالمحاضرة السابقة قلنا انه المايكوبلازما هي من النوع اللي فاقدة للسيل وول، يونيك ستراكشر، هذا اللي هو الموجود يعني قلنا، فهذه البكتيريا فاقدة للسيل وول، وبالتالي هي شو تكون مقاومة لكافة الأدوية أو الأنتيبايوتيك اللي تسبب انهبيشن للسيل وول سينثيسيس، وخصوصا هاي النقطة جدا مهمة، البيتا لاكتام دراجز اللي هي البنسلينز، سيفالوسبورينز، مونوباكتامز، carbapenems and other. The third mechanism is the bacteria may infect the host and the sites where antimicrobial are excluded or not active, such as aminoglycoside, gentamicin are not effective in treating of enteric fever because of the salmonella are intracellular and aminoglycoside do not enter to the cell. Genetic drug resistant, this occur by several mechanisms. The most important antibiotic resistant is the plasmid mediated resistant. The plasmid is an extra chromosomal genetic element self-replicating associated with bacterial resistance of antibiotic. This or plasmid can be divided into F plasmid or plasmid and R plasmids for resistant plasmid. Resistant plasmids carry the gene that is responsible for the production of enzymes that inactivated or destroy antibiotics, such as beta-lactamases, which destroy the beta-lactam ring in penicillins and cephalosporin. Plasmids may result in epidemic resistance among bacteria by moving from one to other by conjugation. For example, resistant to methicillin begin in the Enterococci, the genus Enterococci. Then the plasmid transfer to Staphylococcus aureus and become resistant to methicillin and called methicillin resistant Staph aureus or MERS. Other mechanism is the transposon mediated resistance. Many transposons carry the genes that code for drug resistance. Transposon is a genetic element carry the gene that is responsible for production of virulence factor of bacteria or carry the gene that is responsible for drug resistance. This is easy to move between the plasmid and chromosomes, can be inserted easily in the plasmid and the chromosomes of bacteria. Also, they can transfer this property to the bacteria. This is a process called transposition. The third is the chromosomal drug resistance. Chromosomal drug resistance. This develops as a result of spontaneous mutation in a gene that controls susceptibility to an antimicrobial agent. The most common results of chromosomal mutation is an alteration of receptors of the drug. For example, streptomycin resistance can result from the mutation in chromosomal gene that control the receptor for streptomycin, which located in the 30S subunit of bacterial ribosome. When mutation occur, lead to change in the amino acid sequence of a protein and polypeptide, and lead to appear of a new protein which serve as making the resistant to antibiotics. Now we study complications of antibacterial chemotherapy. This is very important because of lead to several consequences. The first is the development of drug resistance, as talked previously. This is one of the most serious complications of chemotherapy. The emergence of resistant mutants is encouraged by inadequate dosage, prolonged treatment with antibiotic susceptibility testing. طبعا هاي الفقرات الأربعة موجودة بمجتمعنا، دائما نشوف أنه inadequate dosage تستخدم من قبل المرضى، يعني ياخذ علاج من دون مراجعة الطبيب، وعندنا البرولونج تريتمنت استخدام الانتيبيوتيك لفترة طويلة، ووجود يعني نقول closed focus site للانفكشن، بحيث انه البكتيريا دائما موجوده without eradication، مثل ما موجود عندنا in hospital environment, which lead to development of nosocomial infection by resistant bacteria. The problem is more serious when resistant strain developed in the community. In hospital, it's common finding that about 90% of Staph aureus strain are resistant to penicillin. The second complications is drug toxicity. Many of antibacterial drugs have toxic side effects. This can be due to the overdosage, prolonged use, or narrow margin of selective toxicity. For example, tetracycline. Tetracyclines inhibit the growth of and development of the bones and teeth in the developing infants and children. The third complication is superinfection. Superinfection, this may occur by a pre-existing resistant strain present in the environment, such as penicillin-resistant Staph aureus in hospital infection, or another type of superinfection is due to suppression of normal flora by the antibiotic used and their replacement with drug-resistant organism, which causes disease like candida in mouth, causing oral thrush, especially in the children. طبعا استخدام العلاج لمدة طويلة ممكن انه يؤدي الى تثبيط البكتيريا النورمال فلورا الموجودة، وبالتالي enhance the growth of some opportunistic pathogens such as Candida or other type or species of bacteria. The fourth complications of antimicrobial or antibacterial chemotherapy is hypersensitivity. The drug may act as a hapten when bind to tissue protein, lead to stimulation of immune response and lead to tissue damage. This is called hypersensitivity. Any type of hypersensitivity reaction can occur with the several antibiotics, and the most serious is anaphylactic shock, which may occur with penicillin and cephalosporins, also with silva drugs. Mild manifestations are urticaria, skin rash, diarrhea, vomiting, and jaundice. All these may be occur during the usage of some antibiotic. Now, antibiotic used for treatment of infection and can be used for chemoprophylaxis. And the use of antimicrobial agent to prevent rather than to treat infectious diseases. The following are principal conditions for which prophylactic antibiotics are positively indicated, such as the use of benzathine penicillin G injection to prevent reinfection with Streptococcus pyogenes in rheumatic patient, or using of single large dose of amoxicillin, which given immediately prior to dental procedure, or using of rifampicin when the exposed of patient during epidemics of meningitis, or oral administration of tetracycline to prevent cholera and others. شباب اكو سؤال بخصوص المحاضرة؟ منتظر؟
نعم دكتور.
اكو سؤال والشباب؟
سلامتكم دكتور، شكرا جزيلا.